Jim Joyce.
Here we
Happy
are.
Wednesday. Here we
Happy
are
Wednesday to
again.
you.
Um,
Nice.
uh,
You're home, Barcelona.
yeah, that's what we consider home. But certainly lots of travel coming up. Just kind of firing on all cylinders here. But
It's not
enjoying.
conference. It's not conference season right now, right? Like there's not a lot of this is there what's
Um,
going on?
I mean, listen, there's always a conference to go to, right?
Right. Right,
I
right.
think this week, we were actually supposed to be at Radical Health. So our friend Pascal and team were putting that on in
Okay.
Helsinki. Honestly,
Okay.
we just decided there's just so much stuff going on that unfortunately we missed all the great peeps that I was getting some
Right.
selfies with. But anyway, yeah. Um, yeah, I mean, we're sort of gearing up. I mean, the usual kind of health and frontiers later this year. But otherwise, it's just, I think we go to where people are right now.
Yeah,
So,
yeah, yeah.
and
Yeah. Awesome.
anyway, and yourself, you look like you're back to Dublin.
Yeah, Dublin's like about 30 degrees right now. It was actually warmer. I went to Sicily last week for vacation and it was warmer in Dublin than Sicily. So we got so that was kind of unusual, I
Wow.
think. So
Wow.
there's sunshine. The Irish are all red-faced from a little bit of sun for a few days. It's usually the beer, but now it's the sunshine, sunburner beer. So everyone's
Good.
happy and pretending to work. So all
Yeah,
good.
I hear you. It's been beautiful here. But anyway, our guest is here actually. So I'm gonna
Awesome.
let in Ardy is coming right in. He's coming in hot. He's coming in super hot as always, bringing his energy in. I don't know if you guys
Yep.
ever. I don't know if you guys ever met. There he is. Oh, come on! No, you can do it.
There
We
we
got him.
There we
go.
go.
We are here.
Welcome to the shot. I love the hat. Let me see the sneakers. Hold on.
The sneakers cannot be shown
Not
today.
today. All right.
It's
Oh,
only for conferences.
I got you. Well, you'll tell us later. Well, welcome to the shard,
Actually, you know
Ardy.
what? I'll show them to you. Hold on.
All right, all right. Let's do it. Let's do
Why
it.
not?
Wait.
Why not? Just show we got to do it. We'll do it. Here you go.
You got it. There
There you
you
go,
go.
everybody.
SEQSTER.
Custom
Nice.
All Stars just for Eugene and Jim.
Perfect.
Fantastic. I love him. I love him.
Well,
So
with that,
nice to
yeah,
meet
I
you,
was gonna
Artie.
say with
Nice
that
to meet you,
start,
Jim.
as sort of the listeners and viewers are used to, take us through your life journey, Ardy. And if you don't mind, for all of us, pronounce your last name and give us the roots. I have a hypothesis, but I don't think we've ever spoken about it.
Come on,
But
it's
go ahead.
already one man party.
That's your middle name. That I thought.
Yes, that's the middle name. No, it's Ardy Arianpour, and it's always a tongue twister when you say my first name and my last name. They used to screw it up, in elementary school, but I think even as an adult in digital health, they still screw it up. So it's okay. I'm glad you're the first person who's asked, actually. It's so nice.
I listen. I don't believe it, but cool. I appreciate it.
It's
But
only
let
because you're an international citizen just like me, Eugene. That's the only
well,
reason why
Right.
you asked.
Andy's
listen, exactly.
Borkovich.
With a last name like that, I have to honor tough last names as well. So,
Yeah.
Cool.
but all right. So take us back all the way in the history, and then we'll sort of rudely interrupt as usual.
Sure, right on. First off, just a pleasure to see you guys. I hope you both are well, and it's just a pleasure to be on your wonderful podcast. I've been a fan for so long. You and I have been, friends ever since I founded SEQSTER, and so it's taken us years and light
Right.
years to get to here. So this is going to be special. It's not just one shot. It's going to be a 1, 2, 3 punch for
Love it.
everyone here.
Love it.
We're going to have
Love
a total knockout,
Expectation.
talk here. Look, I'm super grateful for the journey. I think digital health obviously has so many different stories, and folks like yourselves have brought on the best of the best to tell the stories. My story is a little bit different. Everyone's story is different.
Yeah.
My story is different because I'm not supposed to be here. I'm not supposed to be talking to you guys. I'm not supposed to have SEQSTER as a company. I'm not supposed to be, a thought leader now in digital health and clinical trials and all the great things that we're doing on patient centricity. It was all an accident, really, to begin with. It all happened by my journey of working at the Salk Institute when I was 16 years old, here in La Jolla, in San Diego. I was lucky enough to be brought up and raised in San Diego in the 90s. I moved actually to San Diego in the mid 80s. And, that really opened up.
Where were you, like 3?
What's that?
Where were you, like 3 years old?
No, I was 6.5. And then I didn't learn English till I was about 9. It was very difficult for me to actually I had trouble learning English because I got planted here.
And where are the roots? Where did you come from?
So I was born in Tehran, Iran, and we fled the Iran.
That was my guess.
War.
That was my guess.
So I was born in the middle of the war, and it was I didn't go to kindergarten. I started first grade here. We spent some time in Helsinki, Finland, and also Stuttgart and Frankfurt in Germany for months, trying to get a visa. Family of 4, me, my brother, my mom, and my dad. And it was no different than, to be honest, what's going on with Ukraine and Russia, unfortunately, currently right now. I totally understand, a lot. And when that happens at such a young age to an immigrant family that sees opportunity in America and just by luck lands in San Diego, California, and not in LA or in New York or San Francisco, where most of folks like ourselves were heading to. Biotech was, huge here. Research and development, and some of the best research institutions in the world were in La Jolla. And I happened to be around the corner, and everyone that I would speak to was either a scientist or a doctor or something within the medical field. So that had a lot of influence.
Is that where you met AMIR, by the way, who was also on the chat at one point, KALALI?
Yeah, so
just
not
to diverge you, but
yeah, no, we have a totally different story. I met him through actually my wife, who runs clinical trials work, and that was from 20 years ago.
Got it.
Okay.
All right.
Yeah.
All right. We'll put you back on track.
During his quintiles, actually.
Yep. Days.
Long time ago. But he happened to be moving here too, and he had a very similar story, background being, Persian and all that too, I guess. I was pre-med, and then my mom got hit with breast cancer. And Eugene, I think you and I have lots of commonality with families being affected with breast cancer and different types of cancers. And then I got really interested in, what that research entails. And I became a, biotech executive in my 20s instead of actually going to medical school. I went and got an MBA part-time. Long story short, I started doing international business development work within next generation sequencing, which was really early on its time in the early 2000s, right after the whole genome got sequenced by, the NIH and Celera.
When it cost millions.
Billions at that time.
Billions, I think. True, yeah.
Right? So now it's, a couple $1,000, but it was a lot of money. And then that was right place at right time. I had one resume, and then next thing you knew, one thing led to another. And I started in the corporate world, and I actually hated the corporate world because I felt like there's so much red tape. You couldn't do and maneuver certain things, but you had to get started somewhere. And then I started when I was 28, I got recruited to my first startup up in Orange County. And that was a small clinical diagnostic company. I was employee number 19. I got recruited as director of business development because I had, 7 years of business development experience. And by the age of 28, if you have that, then, you're one of 1 million, I guess.
Yeah.
And everyone was telling me, why are you going to this, like, small little company? Why don't you go to Roche? Why don't you go to Illumina? Why don't you go to all these companies? Well, long story short, that company I took from 19 people, had the opportunity of a lifetime, and grew it to about 1,000 folks. We raised only $3 million and we sold it for $1 billion to Konica Minolta and the Sovereign Fund of Japan.
Well done.
I had a pepperoni on a pizza, as I was saying. That was more than enough to, become a angel investor myself and build my own incubator. And we'll talk about that and how that led to SEQSTER. But during that time, we were able to fight Myriad Genetics, which it just happens to be that we're doing this call today. But I was one of 4 people that was part of the SCOTUS decision of actually freeing gene patents and fighting, in federal courts. And I was the head architect behind that. And I learned a lot at a young age on what not to do. But what we learned about data within BRCA, or what people know as BRCA 1 or 2, and my team and I created and pioneered the first next-gen sequencing test and cancer panels from a clinical diagnostic standpoint. And we learned a lot about pushing research and development into the clinic, as well as working with pharmaceutical companies, because I created the first genomic services division where pharma companies would outsource to our company at the time and get that work done, since pharma really outsources a lot of that business.
Yeah.
So not only did I learn the clinical world a little bit, I learned the pharma world, as well as actually, made shit happen, right? So At the end of the day, that's probably the best skill that you can get as an entrepreneur. I was not an entrepreneur at all. Again, I'm an accidental entrepreneur because I learned that all this data was being siloed, and my family being affected, my mom being a breast cancer survivor, and carrying various different genetics in our family lineages, had a complete impact on me understanding that you have to have a mission in order to actually build anything. Forget about anything else. You have to have a mission focused and laser focused on that to get people behind doing the hard work that we're all doing, that you are all doing, and that everyone in the industry is doing. Sure, you got to have some luck. You got to have some good timing. At the same time, you got to take some big risks. And so we were able to do that. And I always thought that you should have all your health data in one place, not just your genetics data. And so I thought of SEQSTER, because SEQ for sequencing, because that's where my background of 15 plus years in oncology was. And then STER was all the other data that you can mix in. What I didn't know, Eugene and Jim and the entire audience that's listening to your wonderful podcast,
the millions, the
billions, right?
Billions.
I did not know that your medical data was going to be so important to match with your genetic data. I didn't know that there was going to be 400 plus different wearables and medical devices that are going to be coming out. I did not know that social determinants of, health data was going to be something. I had no clue about claims data at the time when I founded SEQSTER in 2016. But I did know one thing that everyone else didn't know.
What's that?
And that was the fact that ATCG with DNA sequencing is interoperable, and it doesn't matter what machine gene sequencer it comes off. And because we have 15 years of experience looking at millions of data points from that, we thought, oh my God, all this other data is going to be interoperable too, which was not the case.
So let's pause there for a second. So off the bat, all devices that are doing genome sequencing adhere to the same standard out of the box?
Pretty much, because it's a FASTQ file, it's a BAM file, and it's because ATCG from one DNA sequencer is no different than the other. But when you look at the Cerner data the Allscripts data, the Epic data, they have multiple different versions. Your name is categorized differently in different EMRs.
Right.
Vitamin D is categorized 40 different ways, as we use as one example. There's so much more.
Right.
And then when you look at even, let's say, your Apple Watch and your Garmin data, they don't talk to one another because those companies want to silo that data so that you keep buying their devices.
Right.
It's no different with Medtronic data and Dexcom data. The data is completely different. And there's no standardization of that. There's no way to clean that data. So we had to think really quickly of building a data refinery. And that's what SEQSTER really has done. And that's something that I've never shared on any podcast. I've done 62 different podcasts, and today
heard it here first.
About the data
Heard it here first. Heard it here first.
I love that term. So it's a data refinery.
That's right.
Is that how you describe it?
The data. So it's not data aggregation. We started out as data aggregation in 2016 when we didn't know really what we were doing, and no one believed in what we were doing. They thought we were a PHR. They thought we were something like,
honestly, that's what I thought when we met. I thought it was a PHR, right? And then maybe that's a evolution of this, all right. Also,
yeah, what's funny is we didn't even know what a PHR was. I had to Google it to see what a patient health record really was, because we were thinking of it from a multi-generational health record. Actually, I filed the first patents on a multi-generational health record because both my grandmothers at the time, unfortunately, passed to Alzheimer's disease. And no reason to be sorry, but on maternal and paternal line of my family, both of them carried different genetic markers of the APO3 and APO4 genes. And I only knew that because I was one of the first people to be,
sequenced,
clinically whole genome sequenced, right? I mean,
it's so crazy you're talking about this.
Even back in the day in 2011.
I literally just listened to Peter Attia today, exactly on this topic. It was
crazy. And it's interesting. So this is the one thing. I'm probably one of the only people in digital health, in clinical trials, in patient centricity, right? That not only is, came from the outside world, from, another, segment within medical sciences or whatever you want to call it, data sciences, but really from the sequencing side, right? And so when you're a genomics, expert, and in genomics, we were pushing the edge of technologies. When I came to my first PIMS conference in 2016, I was like, oh my God, like, I feel like I'm an alien and I'm visiting the Egyptians and bringing something to build a pyramid or something. How is this industry so archaic? Are we dealing with paper records still? Are you really serious?
Did you have green sneakers then or no?
I did not. I think I was
that came later.
Something that was a different color, but yeah, that came later.
So Ardy,
2017, I think, was the first green Converse, actually.
So going like right before the green Converse. So who are your customers right now?
Yeah, so we've evolved obviously because of customers. Getting back to the story and then kind of weaving it into the customers. We created a nationwide technology on interoperability. And then we built a caregiver view. So not only patients can actually control, collect, and share their data, but also caregivers can. And that all came from my grandmother's side. And then we got a call from Bill Gates. I actually got a call from Bill Gates. It was full surprise. We thought that, what to make of this. Bill was interested in interoperability because his father was affected with AD at the time. In 2018, I get flown to one of his residences, and we sit around the table for 3.5 hours. That was the watershed moment for me when he told me that we had something much more powerful than Microsoft Health Vault. And whether you believe me or not, you guys can go ask Bill yourself if he said that.
Do you mind sharing his
signed
number?
a book for me and said, good luck to SEQSTER.
Yeah.
Awesome.
Anytime Bill Gates tells me one of my companies is more valuable than some part of Microsoft, I'm always like, that's a good day, you know?
That was a good day. Now, this is what's interesting. But at the time, I was all focused on direct to consumer. And I give Bill
Yeah.
all the credit when he said, Ardy, you have an operating system here for healthcare. And it
Right.
didn't like click for me until like a year after, once Takeda and other pharma companies started calling us because they were looking for a way to bring a patient engagement platform. So we were a
Okay.
platform when I founded the company in 2016 until
Right.
I would say 2019. And then 2020, once the pandemic hit and we got our signed, corporate deals first before any investments. Remember, I put the first $1 million in SEQSTER personally myself. And so,
Okay.
we brought my team from data sciences and our ex-CTO from our last exits. We didn't need to worry about anything other than solving problems for patients. We had thousands of women because I spent, over a decade in women's health, and we knew that women were the caregivers. We knew that women, tell men to go to the doctor. They're the ones who take care of the family.
Right.
So we wanted them actually building our system from a UI UX standpoint, not some engineers that don't know anything about healthcare. And
So
that's
Ardy,
the problem with
yeah.
healthcare that I've seen.
So back in 2017 or 2018, there was a direct to consumer offering, and maybe a woman of the household, like a mother or someone concerned, would do what? They would find out about your service and get, or they would, like, how would they interact with it at the time?
Yeah, no one found out about us until Dr. Eric Topol tweeted about it in 2018 of August. We got like millions of hits on our website. It freaking shut our website down. And I'm like, there's no way. I got to raise $500 million to be able to do direct to consumer. And that was right after the whole Bill Gates thing. So, people found out we met with Bill, and then Bill actually, helped us get into Boston University, and he had investments going into there with their Alzheimer's disease fund and things like that. And then we got involved with building the SEQSTER research portal with the Ryan Center for Brain Disease, doing the traumatic brain injury study. And that was when, Jim, we finally figured out, wow, we really do have an operating system. It's a white label for academia. It's a white label for pharma. It's a white label for any digital health company.
Got it.
And then once 2020 hit, this is when decentralized trials blew up because we were all at home behind the box, and folks were interested in our technology for so many different use cases. We didn't know what to do. We picked Pharma because Pharma came and wanted to lead our Series A round. And to be honest with you, I never wanted to raise any
And that
funds.
was Takeda, Bruce and team, right? Or
that was Takeda.
And my buddy Bruce.
We owe Takeda all the credit because we were not thinking around how interoperability can be delivered through clinical trials through the patient. We learned by working with 285 people at Takeda.
Wow. Yeah, because we know Bruce. I know Bruce from lots of years. He was a big. Anyways, we know he's a good guy.
Awesome. Yeah.
So what? Yeah, I was gonna dive deeper. So whether it's pharma, whether it's for a clinical trial or not, so just maybe kind of walk us through a little bit. So if I'm participating in a clinical trial, you obviously there's a record of the individuals that are in the trial. And I've seen something on the website, you connect to like 99% of health systems and others. So you basically suck in their data, whatever's happening during clinical trial, whether it's lab, et cetera. You guys are, back to your comment, you're the operating system for that trial in that case, if it's a clinical trial, where I love the term, the data refinery. So you collect the data, you refine it and make it usable by the researchers to do their magic.
Absolutely. And, it's no better time, Eugene, to talk about this even with AI, because the power of AI begins with data. And so,
Sure.
why am I interjecting that? Because I think it's important for you guys to understand how it works. If you're, AstraZeneca, Pfizer, Takeda, AbbVie, Boehringer Ingelheim, whom we have a multi-year deal with, that they wanted to accelerate patient centricity with our operating system and, power various different clinical trials. How it works is, if you're, any of those entities, you subscribe to SEQSTER, you get a white label where we launch a digital front door of that Pfizer interface, all powered by SEQSTER, of that Boehringer Ingelheim interface, powered by SEQSTER, whatever that life science enterprise is, right? We're just using pharma as an example. Then what happens is, they have various different use cases and different clinical trials that they're running on any given day. They're running hundreds of different trials, but they also have a recruitment problem on not only getting the right patients, but getting the right data. And so we connect the pharma company from a white label service, where we're the OS powering that, to all of the undertaking that took us 5 years to build on the interoperability side, with that 99% coverage. And the flow is no different and as easy as banking. We call it the mint.com flow for healthcare, where you, as a patient, come in that front door for Pfizer or AstraZeneca or whoever it may be, and then you select what your data is that you want to share via consent. And then what's amazing about this, for the first time, and this is what we've really pioneered, is in a clinical trial, the patients get something back. They get to track and monitor and view all their health data. So not only are we a data refinery, but we've actually created the tableau of health data with all of the health visualization on what I call the longitudinal health record, or the individualized health record.
So patients are regularly diving in. So patients that you've interacted with through this clinical trial recruitment process are going back in and interacting with the system. They're kind of diving into it and getting it.
That goes back to Boston University and Bill, because we built the research portal so that the researchers and the physicians and the providers, whoever's part of that trial, can look at that de-identified data, as well as have a communication tool with the patient. So when we're launching any patient registry or any clinical trial with our business currently, it's bi-directional, not only on the data front, but on the communication engagement front. And then when you're thinking about all these pharma companies trying to get into AI now, and everyone talking about AI, I still think AI is hype without data. AI is only useful with data. And, every day you see all these posts about AI. It's great. There's a lot of buzz around it, but without real high fidelity, high quality data, AI is actually worthless.
And what's so your own, so you had this lineage kind of exposure to this Alzheimer's gene. You've been around the space forever. What's blown you away that people don't know from a genetic? What have you seen either from yourselves or family members or patients that this information is from a patient perspective, a personal perspective, has blown you away genetically?
Yeah, I think one of the biggest things is comorbidity of data. And you can have some sort of underlying condition or genetic marker for something, and it can relate to other types of diseases. For example, if BRCA1 or 2 run in your family, people think of breast cancer for women. They don't think about BRCA1 or 2, how it actually can affect, let's say, prostate health, right? That's comorbidity of data. And when you're gathering all sorts of data and matching data longitudinally, you can do what I call trendster within SEQSTER, and you can see the trending of all of the data. And the best way to actually see data And all
Yeah.
the comorbidities is by the visualization of data. That's the best way to QC data. And that's what
Yeah.
our team has pioneered as well. It's magic.
Right. That's cool.
Magic, overnight success since 9 years, right, or whatever. No,
Yeah, since 1986, man.
Yeah, exactly.
It's an overnight success. But you know what's so funny? I'm like the poster child for health data. And what I mean by that is, you know, my mom, breast cancer survivor, my dad of recent, just a couple years ago, colon cancer survivor. We ran a tumor board in 6 hours with SEQSTER, got him in the surgery in 9 business days, saved his life. And if we didn't have SEQSTER, you know, maybe he wouldn't be around. He got to celebrate his 70th birthday in Nice.
Amazing.
Couldn't be more. That's my biggest proud moment, not because SEQSTER is a brand now and people know about it, but you know, how many people do you know that have been able to run a company, start a company, that have been able to actually save someone's life, more importantly, their own family members? I have so many stories with our families. It's nuts.
And you did a tumor board, so you were able to get access to the clinicians, or was there something from the genetic data that kind of surprised you?
Both, actually, because we ran his foundation medicine test, we ran his non-invasive liquid biopsy test, we ran his Cologuard test that showed abnormal results, and then we got him rushed into a colonoscopy. We had his data before his GI called and all his CT scans, and we sent that on a Saturday to 6 different folks, including the prestigious TGen and Dan Van Hoff, one of the top pathologists in the country that one of my co-founders knew for a very long time and working in this field as well. And, you know, that was the breakthrough when they said, you need to get him the surgery right away. And found a 54, millimeter tumor in his ascending colon, and they had to rip it out, and that saved his life. I mean, time kills all deals, I say, not just in business, but in cancer as well. And that's what we've seen with data. It is so powerful, Jim. And you have to experience it.
Are you doing anything like, what I was on vacation last week, so I was reading up on all this or podcasting.
You were reading, period.
Yeah. I was just reading, getting a chance to read but on the microbiome side, I'm blown away by what's happening there. And it feels like, and I was listening to something the other day, they were talking about how this big moment when Clinton was sitting with the team that had sequenced, the genome, and they were talking about, hey, this is going to save lives. But now people are, so is there anything that you're doing there for all this data that's being produced about this whole impactor there? Is that impacting you?
Think of microbiome data as just another data source. The same way that you get genotyping data from, let's say, a 23andMe test or an ancestry, test, or you get an exome, which is, a certain part, 20,000 or so genes that are snipped from part of the genome. Yep. And then the genome is the whole thing. It's the encyclopedia, right?
Right.
So the microbiome is related to a lot of the gut health, right? And that's why you're seeing so much innovation within that. And it's, a lot of the microbiome could be related because your gut and your brain are related. What does that have to do with Alzheimer's data? Lots of research is being done with Alzheimer's disease right now. There's 2 amazing drugs that are coming out, one by Lilly, one by, Biogen. And, the more data that we can collect on this sort of stuff, with not just looking at your amyloid, plaques and MRI data, will better all of us. So what's really interesting with SEQSTER, it is the essence. It is the foundational technology for advancing drug development. And at the end of the day, whether you're dealing with digital therapeutics, digital health, health data, health tech, to me, it's all the same. At the end of the day, what's the underlying thing that you need for all those things? Data.
Data, which we're generating 24/7, our human bodies. But you brought up 23andMe, and we actually had Paul Johnson on this podcast a while back, and I think we forgot to ask him, how does it to work with Anne? And I noticed Anne was one of the investors in your last round. So
Yep.
curious.
So
Tell us about Anne.
yeah, a couple things. So one, I got to meet Anne, very lucky at a young age in my 20s when she started 23andMe. And no one believed in her either, right? And she gets all the credit for being able to bring consumer genomics, consumer genetics to the front. A lot of people were against it at the time because they didn't understand it. The clinicians thought that it wasn't good data, X, Y, and Z, and the technology from the Illumina sequencing side was very early at the time. Now it's gotten obviously a lot better, but I've known Anne for a very long time, since she pretty much founded the company. And I got to work with her company, 23andMe, by launching their exome testing for Parkinson's, actually. So we developed a really nice friendship there, and she's been a mentor for a very long time. And when I told her that I had SEQSTER, she obviously understood it better than anyone, because she was the only person that understood that, wow, if you mix your sequencing data with all the other data, it can mean something. And she was interested in investing in SEQSTER. So just a great, wonderful entrepreneur and a mentor. And we couldn't be more happy to have her, part of SEQSTER.
It's interesting, right? Like, it's one of those statements that if you ask for money, you get advice, but if you ask for advice, you get money, right? So,
and we didn't even want the money, you know what I mean?
It was she was a mentor, right? And and a friend.
Send it this way. Send it this way.
Yeah, I mean, well, look, it's a great time to talk about that too. It's 2023, right?
Yeah.
We're Q2, ending Q2 here. SEQSTER has just exploded in the hardest time. And it's because we've had really good people. It's not about raising funds. Hundreds of millions of dollars, billions of dollars have been raised, as you guys know, in our industry. And how much of it has made an impact is yet to tell. But we've done it opposite. We've only raised, and I only wanted to raise the least amount of money to be able to make the most amount of impact. And the best way to do that is having a solution that actually works. Of course, you need to generate revenues, and you have to be smart and surround yourself around people that are smarter than you. But all this is part of the journey. You don't learn this overnight. It's all part of the journey. And it's something that you do need a little bit of luck with. And I think the harder you work, the luckier you get.
Absolutely.
That almost sounded like an answer to Jim's final usual question, but I think I'll let Jim ask it anyway, and maybe he'll come up with a different thought process there. So why don't we go to the last question?
So picturing yourself, you're sitting in La Jolla at a lovely cafe on a beautiful day, as it seems to always be beautiful there. And a young, clearly Iranian student that had listened to you, and you were speaking at a class, and you knew he was Iranian because you could just tell he's obviously intelligent and a good-looking guy with fantastic sneakers on, green bright sneakers, and you just identified with him. And he walks up to you and he says, Jesus, you like, Ardy, you're my idol. Everything you've done in sequencing, I've been following it, I've been studying it, but I've been on the business development and the science side, and now I've come up with an absolutely phenomenal innovation. It's a next generation AI data refinery offer, and I've got people coming at me. And you look at that younger version of yourself, what's the one piece of advice you would give that young man?
I would say that always go with your gut and take the risk. Don't think twice. Don't let the naysayers stop you. The naysayers and the haters, they're all out there, and you just got to go with your gut and be fearless. That would be my advice.
I absolutely love this advice from somebody who says underlying data is everything. Trust your gut.
And this was all by an accident, I didn't plan this.
I love it. Love it. Well, Ardy, thank you very much pleasure having you. And for all of our listeners and viewers, hit subscribe, pass it on, and see you next week.
I'll
So
give you
wish you
guys
luck,
a
Ardy.
fist bump. Thank you so much for having me, Dean and Jim. You guys are the best. Thank you.
Cheers.
Thanks, Ardy. Best of luck.